Hi, everyone.
Okay, good evening, everybody. I must admit, I feel like I'm on the wrong end of an interview panel here, but welcome to everyone to this meeting. I've been asked to chair in David's absence, as he's away, and we also have an apology from George, I think, just those two at the moment. I'd like to welcome Claire Williams, who's new to the group, but taking a seat from that BHFT hold, so it's not a new appointment, but a new person. So if Claire's online, hopefully, welcome to you.
Yes, thank you, Matt.
Wonderful. Okay, that's great. Nice to see you here. Thank you. Okay, I know that our children and young people's team have other pressing business like Ofsted and CQC send inspections. So we've got them first and second on the agenda, and then no doubt they will like to leave fairly promptly after that, after questions, of course. So we'll get on to that as soon as we can. But first of all, minutes of the previous meeting. Are there any corrections or comments on the minutes? Is everybody happy with those? You can sign them off as a true record. Thank you. Any further declarations of interest from anybody? I can't see the screen very well. Okay. Now we have public question time. I believe there have been no public questions. No public questions. That saved us 30 minutes. That's good. Town and parish council question time. No, none of those either. Councillor question time. And none of those. Okay, we're doing well, aren't we? Okay, so we'll move straight into the first substantive item then. I'll ask Emma to introduce it and your team, please, Emma.
Thank you, Chair. And just alongside, so my name's Emma Cockrell, and I'm the Director of Children's Services here in Wokingham. And I'm joined in presenting an overview of our progress to date in relation to our send and inclusion strategy by colleagues from ICB and also colleagues from our education services within Wokingham. So if I go to colleagues first to introduce themselves and say who they are and their roles. So Nikki, do you want to?
Thanks, Emma. Good evening, everyone. I'm Nikki Cartwright. I'm Director of Performance and Delivery, and SEND sits within my commissioning portfolio, and I work for Bob Integrated Care Board.
Thanks, Nikki. And Lila?
Good evening, I'm Lila Johansson, and I work with Nikki in the ICB, and I'm Head of All Age Learning Disability, Neurodivergence and SEND for the ICB.
Thanks, Lila. And Ming?
Hello, it's Ming, Service Director for Education and SEND.
Thanks, Ming. And Jamie?
Hi, everyone. I'm Jamie Conran. I'm the Head of SEND.
Thank you. And so we have a presentation for health and wellbeing colleagues this evening, as previously we're asked to bring an update to health and wellbeing board in relation, noting to the progress and update in relation to the work that we've been undertaking to improve our offer via our send and inclusion strategy. I think Nick explained the context is that we are currently, we received notification on Monday, the 12th of January, in relation to our area send inspection. And what's key and why we're joined this evening with health colleagues is that responsibility and duties for providing services and support for children with additional needs and their families does not just sit with the local authority. It's very much provided by the local area, and we work as a system to make sure that that children's needs are being met and that they are achieving and thriving in the local area. So without further ado, I shall pass to Ming, I think, who is going to begin talking through the presentation. Jamie, are you going to share it? Yeah.
I'll put it up.
Thank you.
Let me put it on presentation mode. Is that okay? Does that come up?
Not yet, but I have to have my own on the screen. I don't know whether members seeing what's being presented on the screen or not. Oh, it's there now.
Yeah, I think it.
Yeah, thank Emma.
Might want to put it in slideshow,
Yeah.
Jamie.
It's on slideshow on mine.
3.
Yeah.
Slide 3.
Is that okay?
Yeah, okay, go next slide, please. Emma, just introduce this, what are we going to present to member today. It's our SEND inclusion strategy. I'm now going to give member the more heads up on our vision and priority, how we come about to agree those are the vision priority. In the past 2 or 3 years, we are moving into a sort of system. We want every agency, every part of provider, support teams in local authority, in ICB, we all come to the agreement. We have a same vision. We share the agreed priorities and agreed ambition. So for that, we believe it's very, very important. We need to do this through a co-production process. So we have held several co-production session workshop with the parent, young people, and health provider, social care, education, and school, education service and school as well. In reaching this vision, I just don't want to read out the vision. The vision is really linked up with our all children service vision, not just for SEND children. It's for the borough where all children and young people are visible, valued, and included in the communities. And they are safe and cared for, they achieve their potential and are healthy and happy, hopeful and love. So let's reflect on everything we are doing jointly. This is very important. And through the workshop, we all signed up to this, including children and young people. They agree to this vision that we have. And then we commissioned some research to identify any good practice, anything we need to particularly pay attention to in the current sort of moving landscape in SEND inclusion. And also we carry out surveys. I just mentioned the word community is very important. We understand community. We get the feedback from the community. That survey has been great help. And then let inform our direction of travel. Those high levels vision and priorities will be operationalized through ambition action that we need to deliver in next 5 years. And then again, those actions are co-produced and was informed by what I just said, surveys, feedback from various agencies. So Jamie will talk more about that. So let's document again, internal governance, like come to the Education Partnership Board, went to the Education Partnership, SEMI Partnership Board, Value Partnership Board, also local authorities, our local authority governance, and the health ICBs, like governance structure, all they knit together. And then we have the same inclusion strategy. And we also show it to DFE advisor and CQC advisor. They all agree it is a robust strategy. Next slide, please. Jeremy, next slide, please.
Yeah, I've done it. I think Teams is
Okay,
playing
not
up a
worry.
bit. We got an alert. So
Not worry. I have that. I have that. Yeah, yeah. So I just now I mentioned about the priorities. Yeah, while waiting for the slide, there are 5 priorities are coming out now. Yeah, obviously, for having a robust same inclusion system where all children and young people will get their need addressed, having an inclusive system is vitally important. So children and young people can get access and to receive early intervention, receive the intervention at the right time, at the right place. So that's the number 1 priority we identified, again, informed by co-production group. And member may be aware across the country, sufficiency of SEND have been a challenge across the country. So we place it as another important priority for local system to address. So for that, we have put resource together. We work out the long term, not just look at what we need now. Otherwise, you always get into the firefighting mood. So we know our need in 5 years' time, in 10 years' time. Let it inform our action, our decision, strategic decision and action. For example, how many special school need, what kind of special resources unit we need, etc. So that's sufficiency planning linked to this same inclusion work as a priority. And the third one is very, very important, joint commissioning. We are talking about various agencies, health, education, social care, school, and the provider within the care as well, working together with the robust, routine, whole cycle joint commissioning approach. We will make sure we have effective system will address the need that have been identified. So all children and young people get a consistent support that they need. And transition, which have been identified in our last inspection, you any member have been here long enough, as one of the priority in our last inspection, 2019. I was not here anyway. The lead transition not just about preparing for adulthood, it's also about transition for children who are at the early years. They need to be school ready. They need to have best start in life. We're going to talk about that, how we can prepare them to transition to next stage of learning. Or indeed, it can be transition from someone who need alternative provision because they cannot attend mainstream school. How can translate back to mainstream school? So all those transitions are complex, but now we have a very, very robust system in place. Jeremy, again, will elaborate more exactly what we do as action. Communication, I always raise by the community and the parent and the providers and the agency as a priority. Across country, again, it's I think issues. Some parents may feel they do not receive effective communication. Some agencies may feel the communication between themselves are not good enough. I have to say that you compare to 2 years ago, that we are in totally different place. Again, Jeremy can elaborate. Now we have so many positive feedback from agency, from school, from parent about the service we deliver. Of course, we still have challenge. We still have some parents feel they need to get the communication they wanted. Sometimes you do give it communication, whether it's kind of the thing you address what they ask for, or meet the expectation or not. Again, it's something we won't work hard. We want to make sure everyone feel they receive the best effective communication. So those are the 5 priorities they all need together. Jamie will be able to give you more detail about what it means in reality. Jamie,
Okay.
hand it over to you.
Thanks, Ming. Before I go on to the next slide, and I think there's a delay in it coming up, but what I'm going to do, and I think Lila's going to chip in as well, I'll go through each of the strategic priorities and talk through, I won't go through everything. There's a lot of sort of headline detail on each slide. I'll talk through the real areas of progress that we've made, and noting that it's a area SEND inclusion strategy from 2024 to 2029. So this is a progress update, but I hope you can see as we go through, there's a tremendous amount of work that's been undertaken and across the partnership, and lots to really be proud about and to celebrate, but obviously a lot more work to do. So what you'll see in these slides is a huge collective effort alongside an indication of our next steps and where we're trying to keep developing. So the first one is the strategic priority 1, inclusion, access and early intervention. Hopefully the slide's loading for you. If not, I'll just talk to it. So one of the main pieces of work that we've done in terms of progress and achievements, and something that I think we should be really proud of as an area, is we co-designed and have widely launched our ordinarily available provision guidance. So this guidance sets out all of the provision that children can access in school, and it was co-designed with a number of our SEND coordinators, so SENCOs in schools, as well as our Parent Carer Forum. They contributed as well. So it's really high quality. We've included links to everything that we're going to talk about here in a slide at the end, so you can have a look for yourself, and I would encourage anyone that's interested, go and have a look. It's something that as a partnership, Wokingham should be really proud of. It's really high quality, it's really accessible, and we've had a great response from our school community, as well as parents and carers that have seen it to date. We've really tried to improve our relationships and partnership working with SENCOs, strengthened our SENCO network meetings. We've got a newsletter that goes out to SENCOs every term, and an improved hub where they can access a range of guidance to support them. SENCO is such a busy role in a really accessible way. And we've also set up a SENCO induction program. So we delivered that in 2024-2025 academic year for the first time, and we had 16 new or recently qualified SENCOs that participated in it. And we've received some fantastic feedback from the attendees of that completed that program, particularly around building confidence and that partnership, working with other SENCOs and knowing who to contact when they had a question or they wanted to share some excellent practice, for example. We've got partnership for inclusion for neurodiversity in schools. I don't know, Lila, whether you want to chip in anything around PINs.
Yes, so that's been very successful, and I think has been well received by the 30 schools that we're working with. And the feedback that we got through that programme of work has informed the support that we are developing to go into schools. Learning walks is one of those. We have done some work previously, and it's sort of emerging evidence-based nationally, but learning walks where we go out as a multidisciplinary approach, working with our education colleagues to think around how we can make reasonable adjustments within the settings. And then what will follow out that will be individual action plans for schools, and then there will be support to follow up on those action plans going forward. And I think one of the sort of exciting things that we did a presentation at the National Community of Practice. We were approached specifically to evidence around how we've done co-production, and I think we've worked very, very closely with the Parent Carers Forum, who are helping us reach out to parents. And one of the key elements that I think has come out of there is that we will be working specifically around developing tools for masking. So we had overwhelming feedback from parents around how masking in schools and at home is a bigger issue than I think anybody thought about. And so we're able to bring some of that learning into the national arena as well, which is very exciting. And I think we'll continue working on that. Do you want me to go on to the next steps? Yeah. So we're going to organise a Send Inclusion conference, and I think that's at the end of this month. And some of the PINS funding has helped support that, and we will use some of the learning from PINS as part of that event as well. And we're also working on setting up another event around celebrating the work that schools have done around PINS and how they've engaged and the difference that's now starting to make for children. And I think the last thing about procuring a strength and needs-based tool, we work quite hard across 6 local authorities in Berkshire. It's a major co-production work with educations, settings, families, parent carers forums around how we can work in a more needs-led way and be less dependent on a diagnostic approach to supporting our children. And we're just in the middle of talking about how we might procure a tool together that will be rolled out across Wokingham. And there's been co-production around a Wokingham specific action plan to make that happen. So those are some really exciting developments. Do you want to go to the next slide?
Yeah, I'll go back onto sufficiency. So I won't talk through because I'm conscious of time, and I know there's it's a busy agenda. So in terms of sufficiency of SEND services, we produced a sufficiency statement from 2025 to 2030. So we know exactly what places we need for our children and young people, and we're working through a plan to develop that provision to support Wokingham children to remain in Wokingham in order to access the provision that they need. Something that's been a recent real success, really. We recruited a independent travel trainer, and we've got a great independent travel training offer to help promote independence and access to the local community. We've had 18 young people already complete that independent travel training, with a further 6 that are currently working through that. We've created additional places in post 16 in one of our local specialist settings, and we've got 2 new provisions that we created attached to our mainstream primary schools. And they celebrated opening a new building in one of those settings yesterday, and I've read some of the read about some of the experiences of the children and young children that are accessing that provision, and it's really fantastic to read. It's made such a difference and had such an impact for that cohort of children that have accessed that, and we're building up to more places there as well, so delivering a total of 42 places by 2028. So we want to keep working with our school partners to develop alternative provision model. So our own schools having our own alternative provision. We are also planning doing some joint planning with the ICB to meet health needs as we develop these new provisions. And something really exciting for September 2026 in the old library in Wokingham is our post 16 hub. It's really exciting. We've had input from young people to help co-design the space, what it looks like, what it feels like. And we're also opening 6 new resource bases and SEND designated units across the local authority in the 2026-27 academic year, creating 35 additional places in the first year, ramping up to 112 additional places over time. So a huge effort there in terms of creating additional places for Wokingham children and young people. I'll go on to joint commissioning. I don't know, is there anything that stands out here that you want to take, Lila?
Yes, I think there's a couple of things that are worth mentioning. So we've got joint multi-agency inclusion clinics now, which is starting to make a difference. There's a bit more work to do around that, but that has been showing some early success. We've got dynamic support register meetings set up, which are multi-agency, and we can start evidencing the impact that's having on children not ending up in tier 4, and more collaborative working for us to work together and holding risk around some of those more complex situations that some young people find themselves in. There's a joint funding panel that's been set up for children with the most complex needs, which is starting to have an impact. And I think just worth mentioning as next steps, we are working together on a children's joint strategic needs analysis, working in partnership that will help us set priorities going forward and analyse needs for children with SEND.
Thank you. I'm going to keep whizzing through. In terms of transition, so Ming already referred to earlier, it's not about just transitions into adulthood, but we have done a lot in that space. So we recruited a post-16 and preparation for adulthood strategic lead who chairs a post-16 panel, which has enabled that real partnership input so we can plan next steps for young people in Wokingham. We really improved strengthened our relations with FE colleges. So there's lots in neighbouring local authorities, and we've been able to carve out pathways that really are aligned with what Wokingham young people were telling us that they wanted. And we've managed to increase the number of young people with EHC plans attending FE colleges by 4%, which is now currently 3% above national and regional average. So that's a huge turnaround. So our young people being able to access FE colleges and do the pathways and the courses that they want to do. I've already spoken about the post-16 hub, co-design with young people. We host an annual PFA, Preparation for Adulthood Market Stall event, which is in person, and that showcases the range of opportunities for Wokingham young people to access. And in terms of next steps, we're really excited about creating a Pan Berkshire employment forum. So being able to work with businesses to really offer a range of opportunities for our young people to access employment as a next step, should they wish to do that. Move on to priority 5. So this is around communication and co-production. I think in terms of communication within SEND, and certainly in the service that I'm responsible for, communication is such a big thing. And we've worked really hard. We've listened to parents and carers in particular, and SEND Voices, our parent carer forum, have been really helpful in articulating what parents and carers were experiencing challenges with our service. And we've produced a communication promise. We've detailed escalation processes. So if you can't get through to your officer, who do you go to next? And we've published a lot of You Said We Did. So we've listened to feedback and what have we done about it. All of this is available on our local offer. And we've tried to produce as much accessible. It's a really complex area that we work in and that families are trying to navigate. So we've tried to produce as much accessible information as we can relating to our decision making and other quite complex processes. And we piloted in the autumn last year SEND drop-in. So families to turn up, and if they've got any questions or concerns around anything, they could meet with someone either in person, and we did offer online as well. And that's been working well. We're carrying that on this spring term. Something really positive to shout about is we recruited our participation manager. We've got a participation strategy and a pool of participation champions. So across our partnership, we've got officers and young people really promoting best practice and genuine co-design and co-production with children and young people across our borough. And we've got one coming up on Monday. We've got an evening session, or we attend evening sessions as a partnership through our Parent Carer Forum Send Voices, to really strengthen communication from across our leadership teams, and share and inform families of what we're trying to do next to improve services for children and young people. Just some bits and pieces on you may remember from just the start slide, all of this systems and operational underpins the other strategies. We've got a real commitment to identifying and delivering best practice through a range of tools, that things like, they're called courageous conversations or targeted support. They're initiatives that are supported either by the DFE or in our region, South East 19 region, to really try and promote the best possible practice in Wokingham Borough. We've got an education healthcare plan audit tool that we've implemented, and an audit programme with the whole partnership inputting into, to really make sure we've got the best quality EHC plans for our children and young people. We continue to try and work as a partnership through understanding our data, understanding the areas that we're doing really well for our children and young people, but also helping to use data to identify where we need to strengthen our practice and oversight further. And then I don't know whether there's anything else, Lila, in terms of QA for health contributions.
I think just very briefly mentioning, to support that QA process, Health and now have introduced a framework within health settings that will support that overall oversight of quality and improvement, and training for staff to ensure that the plans look the best that they can, and that the voice of the child comes through in those plans, and they are effective and delivers the outcomes that we're intending for them to deliver.
Okay, thank you. So I'll move on. So that's just that. I mean, I've scanned through, or given you a whistle-stop tour of the huge areas really of work as we deliver our Send and Inclusion strategy. We asked for some reflections from our Parent Carer Forum, which they've provided here, and I'm just going to read some of this out on their behalf. So they felt what was going well, that real strategic co-production, so feedback from families that they help to bring together through an annual Send survey, and termly feedback is delivered through our strategic boards and steering groups. They're also, families are included, or parent carers are included on various working groups and work streams to understand their lived experience. And they also reference PINs, which Lila's already talked about. In terms of what could be approved, lots of this stuff we've talked about already. So inclusion in mainstream schools, and they referenced the ordinarily available provision guidance that I spoke about earlier. Increase in parental support, and co-production at an individual level for parents, carers, children and young people. And again, support and communication has cropped up, which we know that we're going to continue to focus on and drive that improvement work moving forward. Ming, I'm going to hand back over to you. It's next steps and strategic direction. I don't know whether it's refreshed the slide, but
thank you, Jamie. Yeah, thank you, Jamie. Yeah, thank you. Yeah, I think it's what we have heard, I think what you have heard already give you some indication. Some work in the past 2 years, we come a long way, but there are a lot of further work need to be done. We recognize that. The first thing, just now we talk about joint commissioning, how we can knit together all those different parts of the commissioning work, provisions, and the surveys. Although we have made a lot of progress in that, children young will get much better support. We want to just now use the word more kind of so embedding our surveys as a joint commissioning, become a routine, a whole cycle from commission or survey procurement, deliver survey evaluation. That's a system which is still working on. That will be our next step priority. The second thing we talk about, in order for us to have an evidence-based approach, we need to have a better qualitative and quantitative data with good analysis that we inform strategic decision and operational action as well. That's another thing. Again, we move forward a lot, but the more thing need to be done. Jeremy already moved into, already talked about another priority like assistant. We need to put into QA system, data collection system, how also share the data between different part of the system, ICB, health and education, school, social care, etc. That's something we still want to put more effort to further strengthen it. Another thing, the third thing is the priority for us. Member may have heard about some white paper coming out. And still, we keep delaying that, but we were told it's coming up. But we know the principle underneath that is have an inclusive system, inclusive education. So easy said, not Hattie said, not easy to be done. So how to support school leader to have an inclusive system in which all children, not necessarily all children with the ESCP, is kind of identification to get support. Everyone gets the good, best support, including children who have education, health, and care plan, or same children. So that's kind of thing. We move forward a lot. We have 2 education conference. We have some really expert on inclusion. They kind of help us to move this forward. And then the last thing is, as you have heard of the family first, the best start in life reform, we want to embed some improvement in the family first and best start in life reform. Later on, we're going to hear about best start in life presentation. That's our next step, the 4 key points.
I'll flip the next slide. It might be a time lag, but those are just some useful links to anything that we've talked about today. There's links on our local offer website that provides a bit more detail if you are interested.
That concludes our presentation. And so any questions?
Okay, well, thank you very much for a very comprehensive and thorough presentation, actually, and congratulations on the quality of the report. It's clear you're making some good progress, and there is, as you say, an awful lot of work going on behind that report. Have a question in the room from Prue?
It's not really a question. I'm the lead member for Children's Services, so I can't not say anything on this. I've been doing this role for about 3.5 years since we took over the administration. The change is huge, and it's largely down to the people who gave that presentation, who have given their all to make those changes. We had a very long way to go. We've come a very long way. There's still more to do. I wouldn't, we're not claiming we're perfect or anything, but the change, the strategies that we've got in place, the strategic thought that's gone into it, the working together and the partnership and listening to the children and co-producing stuff, it's just changed everything. Not just working with health, but also with our education colleagues. Yesterday, I had the privilege to be at the opening of the new build of the unit at Radstock. And when I started, relationship with schools was not great. The resource bases that we had were not working. We're not financed properly. We had no plans. We didn't have SEND sufficiency included in our overall place planning strategy and all those things. We've now sorted all that. The base is fantastic. The school were really praising of the council and everybody involved with the project. And the most important thing to me was they said it has made a difference to the children. Obviously, they've been in the unit. It was the official opening yesterday, but they were working in temporary accommodation to start off with, and they've been in that unit for a little while. It's made such a difference to the children, and that's what it's about for me. And I think to see them working like that at fantastic facilities and the children flourishing is amazing. I think the final thing I want to say about it is that in the autumn there was a day of protest by parents around the country who were asked to bring pairs of shoes and leave them in the council offices because of the difficulties that we've had with SEND. We did not get a single pair of shoes. And I take that as a badge of honour. We still have some issues to sort out. We still have some unhappy parents. We have some things that historically have not gone right, which people are carrying with them, as well as some new things. I'm not going to claim everything's perfect, but I was so pleased that the parents felt that they didn't need to make that process. They have a voice with us now. We go to the SEND Voices, and SEND Voices have been a fantastic partner with us. And I really feel this is going the right direction now. And it was just glorious yesterday to see how happy everybody was with the unit and see the children.
Excellent, thank you. Very timely as well, by the sounds of it. Stephen.
Thank you. Well, I do have a little question tucked in at the end of what I'm going to say, but much of what I'm going to say is going to echo what Prue has just said. I wanted to really express my thanks to all of those who've been involved in what has been, I think, little short of a miraculous transformation in the way in which we are addressing these kind of challenges. And I think there are so many features of this presentation this evening that I want to applaud, that I will go on for far too long if I do so, but just to pick out a few really significant things. I think the first thing I want to emphasise is the expansion of provision for SEND pupils within the borough. And that's really significant in terms of the quality of life and experience for SEND pupils. That's the most important element of this, of course, but it is also helpful to the council. It helps protect the council from rising home to school transport costs, and it enables us to really have a win-win where it's good for the pupils and their parents and it's good for the council. So that's one thing to particularly applaud. I also want to applaud the commitment to co-production, the commitment to early intervention, and the commitment to partnership. Co-production is itself a form of partnership, but partnership threads all the way through this. And I guess my final point, before I move on to my little question, is how good it is to see this coming together in a coherent strategy, and that strategy starting with a clear vision of what we want to achieve. And that vision resonates very much with me because it really reflects the vision that I think we have for the council as a whole, that we want to create inclusive communities, truly inclusive communities, where everyone, regardless of who they are, has the opportunity to thrive. And this strategy exemplifies that ambition. So I'm really very, very, very pleased and proud of what has been achieved, and want to thank all of you who've played a role in that. I'm very, very grateful. And my little question, it is only a little question, is I noticed the Berkshire-wide employment initiative, and I think that really does reflect something that SEND pupils are keen to see. They want employment opportunities. Again, that's part of being able to live more fulfilling and richer lives. But I wondered about the mechanisms for pursuing this. I mean, we have now a Berkshire Prosperity Board, which brings together the 6 Berkshire Unitary Councils, and we have a Berkshire Business Board, which supports and works with the Prosperity Board. And I don't know how much work we're doing in conjunction with those bodies, or whether this is a separate initiative that's taking place in parallel with what they're doing. But it may be worth, if you're not already doing so, linking up with the Berkshire Prosperity Board and the business board that supports it, just to see how we can progress this.
Thank you, Stephen. Who'd like to respond to that question?
If I could come in on that, is that okay?
Please do.
So thank you. It's again really timely. So it's embryonic. So we're right at the start of this, where Wokiнгham's trying to lead in this space of an employment forum across Berkshire. So I've jotted down the systems that you've referenced, and I'll go and check that with the colleagues that are leading that space to make sure if there is an opportunity to either do that in sort of partnership or as part of that, or alongside, that we're cited one another, so it's not competing, if that makes sense.
It does make great sense, Jamie. And if you do need to pursue this, I would recommend you talk to George Framalico, Director of Place and Growth, who's playing a key role in the work of the Berkshire Prosperity Board in particular. And I think he would be able to facilitate that bringing together if it's necessary.
Thank you.
Great, thank you. Ming, did you want to respond on that point as well?
You're muting.
I was just saying, Susan before me, probably she won't say something before I can just add something to what Jamie just said. Susan, after you, Susan.
Okay, thank you. Is it okay, Chair, if I ask a question now?
Please, of course, yeah.
Okay, thank you. So apologies that I couldn't be in the room, physically in the room tonight. Just wanted to say absolutely really fantastic presentation there. And the change that Prue and Stephen have articulated, that I won't repeat, but it's absolutely amazing in terms of what we can see. And I think what's I really love as well is the clarity of what you've articulated in terms of the changes that have taken place and the impact. And then, of course, that final slide about the reflections from Send Voices about what they feel is going well and then what can be improved. So I thought it's really a really fantastic presentation, and particularly representing that whole sort of system change, so thank you for that. And obviously impacting on young people. I must admit, I've seen the ordinary available information in a hard copy, which is brilliant. And again, it was I saw it some months ago, and it's really really accessible information, which is great. I wanted to ask in particular about the dynamic support register, I think, Lila, that you mentioned. And I wondered if you can say a little bit more about the impact of that. Thank you.
Yes, so just a little bit of background. It's a national policy that's come out through NHS England. So what we saw historically under Transforming Care, that lots of individuals with a learning disability ended up in psychiatric inpatient settings. That program has developed over the years. It has now got a clear focus on children as well as adults. So we're now required to have what's called a dynamic support register, where we track children and young people who are at risk of admission to a psychiatric inpatient unit known as Tier 4, or those who are coming out of Tier 4, so we can support them adequately. And I think what we can see over time, Susan, how those numbers have come down significantly, and we are below the trajectory that we've been set by NHS England. It's not to say there's not more work to do, but certainly in the first year we've had the panels up and running. I think the partnership around how we work together around those young children who are, experiencing very distressing circumstances, really building on our relationships and how we do that system wrap around those families and individuals.
Thank you.
Okay, so
Chair, may I come back just to add what I just now wanted to say?
okay.
Yeah, thank Chair. Yeah, it's just that in answering Stephen, the council leader's question about the link up with place economic department, that has already been happening. Actually, just 2 weeks ago, his service director and head of service, Karen and Nikki, invite me to jointly to work this through by incorporating the need of SEND children and look after children as well. So that's happening. We will report back.
Okay, thank you very much. Right, if there are no further questions or comments, we'll move on to the next item. So the next item on the agenda is Wokingham's Best Start in Life strategy. We've been asked to note the key priorities that are proposed, and also we'll be asked at the end to approve the Best Start in Life strategy. So I'll turn back to Emma to introduce this again, please.
Thank you. So we're all about children this evening, which is very lovely to to be a part of, and to have present at the Health and Wellbeing Board. So I just in terms of introducing those who will speak to the strategy. So Ming may make some comment, but we're joined by Lorna Jacks, who has been supporting the development of the strategy and the articulation of the priorities. Just to say, in similar to our Best Start in Life, similar to our Send and Inclusion strategy, these are not solely Wokingham Borough Council strategies. They belong to the partnership. They're developed in partnership, and crucially developed in partnership with parents and carers. So I shall hand over to Lorna, who will give an overview and take us through the strategy, its development, and its priorities. Thank you.
Lovely. Hello, everybody. So the Best Start in Life strategy that you'll see in your papers and the report covers pre-birth up until 5 years old. And I thought what I'd do is just talk through some of the context and the overview, really, of where we've got to with the strategy, and then open to thoughts and comments. So our Best Start in Life strategy is for our early years, and the context of why this is coming now and why we've built on it now is that we have a duty under the Childcare Act in 2006 and 2016 to present that we have sufficient childcare for our population within the borough, and every area is required to do so. And most areas will put that within an early years strategy that also supports other things around actually what's on offer for our wider system and how people can access support. And in Wokingham, we haven't had that as yet. And so we have been really keen to ensure that we are able to actually respond to that duty. And alongside that, as part of our broader kind of priorities as a whole borough, looking at prevention and narrowing the health inequality gap and our overarching goals for children to thrive, we know that within that pre-birth up until 5 years old age range and for those families, that we will see the most significant influence for their lives within that period over their life course. So what happens in that stage has the most significant influence for their long-term life outcomes. And so we are so keen to ensure that we look at this population and the families and how we're actually narrowing the health inequality gap here. And thirdly, we are aware as a whole system that we want to improve and strengthen our system working, both within the insights that we share together, for example, through like our joint strategic needs assessment development, but also in our understanding of family whole experience, how people are and are not accessing universal services, and the stigma in which we are aware that some families might. We want to ensure that we're reviewing that within our early years population. Nationally, the context is that we have, over the last kind of 8 years, there's been significant research on what actually happens within that first 1,001 days of a child's life. And there has been research last year about the long-term outcomes for families when services do join up better together, when we do provide things in a much more integrated way, and how that supports employment, how that supports attainment at school, and physical health and well-being. And then in 2021, there was a Best Start in Life paper that set out the kind of the overarching framework for what could that look like for early years across the whole country. And so last year in the autumn, the government outlined that they would like every local area in the country to be developing Best Start in Life plans and also Best Start family hubs as our integrated way of working for our early years families. And we've also seen that the way in which we measure child development, we've seen the childhood development decline post-COVID, but most starkly, we've seen that attainment gap widening for children that are eligible for free school meals. So at the point of reception, we're seeing a real difference in attainment for those eligible for free school meals and those that are not. And we see that in Wokingham, and the government have given us targets as of November and December on how much percentage-wise we are set to improve as a whole population in Wokingham for those levels of development. So we have got this national context of seeking to publish a Best Start plan by March 2026, of which this strategy answers that, and some specific targets for good levels of development by 2028. So our local Wokingham strategy development started towards the end of November 2024, beginning 2025, with the London Government Association review into our early years services, and much review in terms of our data with our health colleagues and children's centres and such. And then as a whole system, we've been building our strategy from April last year up until the autumn, where we've been making our decisions together with parents and carers, and with the voluntary sector, education, health, speech and language, etc., libraries, and working both with practitioners, people on the ground, and strategic leads to look at this goal that we've set out in our strategy. So our strategy and our goal is to grow the village for families in Wokingham. And I just wanted to point out some key notes on the strategy, which are that it's not just a child development focus. You'll see that it's much broader than just looking at, for example, improving reading or writing or educational attainment. We are building our strategy on much more kind of lifelong family outcomes around belonging, being included, access to social networks and connections, knowing that this has fantastic outcomes for the whole family. As Emma said, this was formed as a system and not just the local authority. And it's not introducing anything new financially other than what we've already been approved. And alongside this strategy will be a much more detailed delivery plan where each part of the system will be outlining their kind of key deliverables against this plan. This has already started, and we've already started actually some of the kind of momentum and delivery underneath this strategy in terms of just better ways of working together and trialing more dynamic local ways of delivering our services within community settings and together with voluntary sector partners. So we're at the beginning of the journey, but this is the overview and the outline for the strategy, and yeah, really keen to hear your thoughts and questions and any feedback. Just stop.
Okay, thank you very much for that presentation. The publication is certainly very clear and easy to read. So, Prue.
Once again, as a lead for Children's Services, I'd like to just commend everybody who's been involved with producing this strategy, including Lorna herself, but there's a couple of other people, Elaine Munro being one of them, who has had a big hand in developing the early years part of Children's Services. The government have rebranded early years as Best Start in Life. That has helped us to some extent because we were getting quite muddled up between the words early years and early help, where early help is helping people at an early stage, and people didn't always understand the difference between that and early years, which is young children. So Best Start in Life is helpful in some ways, but it chimes so well. The word that Lorna didn't use was marmot, so it chimes perfectly with our intention to be a marmot place, and obviously one of the key marmot principles is that the getting children off to the best start in life is the way to improve their chances all the way through their life. And so I'm really pleased to see this, and I would sort of ask the Health and Wellbeing Board if we could have an annual update on this at least as it goes through to see how the progress is doing, because it's quite key to our vision for the borough and to the marmot principles that we're trying to adhere to. But it's a really good piece of work, and I really love the photos in it as well. So that's just an added feature. It's not the biggest thing, but it's a really engaging piece of work as well as a really important one.
Excellent, thank you. Madeline will note the request for an annual update, I'm sure. Stephen.
Yep, well, Prue's largely still on my tender. I also want to thank everyone involved in the production of this and all the work that's gone on behind it. I also was going to make the point about Marmot. The best start in life for our young people is an absolutely crucial building block for good public health that Marmot seeks to attain for us. And I think this really fits beautifully into the work we're doing on Marmot. I would very much welcome that idea of an annual update and presentation so that we know what progress is being made. But thank you again on my behalf for all that you've been doing.
Okay, thank you for that, Stephen. Amit, I think you would like to make a comment?
Thanks,
Welcome.
Chair. No, just a comment I just put in the chat. It's just to say, really helpful to hear the strategy update and where we're going with sort of Best Start. I think I was just making the point we need to align the Best Start hub work, especially with paediatric clinical MDTs and the mental health and schools work. I think there's emerging work around that from NHS England as well. That's a triumvirate approach, linking together, aligning that work. So yeah, really welcome the opportunity to do that in the coming year or two.
Yeah, absolutely. Thank you, Amit.
Okay, thank you. Any further comments or questions from anybody? No, I'm looking online. No? Okay, in that case, can I ask for a vote from the room to approve the strategy? Yep, all in favour? Anyone against? Any abstentions? No? Lovely. Okay, that's all agreed. Thank you very much indeed. Okay, so we move now to the update from Royal Berks. Andrew, I think.
Hi, thank you, Chair. And thanks for the opportunity to talk to the Health and Wellbeing Board this evening. I won't read through the slide deck that people have had in the packs. I just wanted to just remark that we are still in the midst of the Christmas and New Year period. The hospital's very busy, probably no busier than we've been in the last couple of winters, and teams are working really hard to support patients through that. You'll be aware that we've had a further period of resident doctor action, industrial action just before the Christmas period, which again is disruptive and has required us to bring in the more senior consultant support to get us through that period. We've been able to maintain a lot of our elective work through that, but it has come at a cost to the organisation and to the individuals as we've been doing that. I think more broadly, we've just received the latest quarterly league tables for hospitals. We're really proud of the results of that and how we're doing across the balanced scorecard. We think we are the second highest performing acute trust after you discount the specialist or single service line organisations in the league table, which again is a really great result for the residents of Wokingham, and a tribute to the work that the teams on the ground are doing to support patients every day. Looking forward, we're in the midst of the NHS 3-year planning and budget agreement cycle at the moment, which is charting the course for the years ahead. We're working very collaboratively on some of the innovation fund bids that colleagues from BHFT and Primary Care and Wokingham Local Authority are supporting on. And then finally, we are working on potential sites for the new hospital, which we hope to do the technical work on by the end of the year, and then we should be able to talk a bit more about what we've found and learned from that piece of work. I think that's all I wanted to say. Really happy to take any questions or reflections from the room or those online.
Thank you, Andrew. Are there any questions or comments?
I was going to offer congratulations, Andrew, on your success in your league table position. I think that's a great achievement, and you're to be congratulated. And I hope you'll pass on our congratulations and thanks for the work you and your colleagues are doing to enable that improvement in your position in the league table to have been achieved. I also just wanted to express sympathy for anyone going through a 3-year finance settlement. That's what we're going through at the moment, and it's not easy, I know.
Yeah, thank you.
Thank you, Stephen. Any other comments, questions? You've been let off lightly, Andrew, I think. Okay. The next item is a proposal about membership. I should formally welcome Amit to the meeting. Just to introduce this and the background behind it, really, there's a strategic move now towards neighbourhood working and that approach in health, and moving to more of a partnership approach at neighbourhood and community level. although the official guidance, I think, is still yet to be published on neighbourhood working and what it should look like, it's clear the Health and Wellbeing Board will have an important role to play. This is where we will determine what neighbourhood working in Wokingham will look like. The neighbourhood health plans need to be agreed and then signed off by the Health and Wellbeing Board, and this will need to be done by the end of April, we understand. Through the whip, it has been agreed that the Director of Public Health will hold the pen, I think is a phrase, on the plan, but it will be produced by collaborative effort, and I guess that is co-production, is it, in these terms? This may necessitate us to have an additional formal board meeting in April, depending on those timescales, but we'll confirm this at a later date. It may possibly replace a steering group meeting, but we don't know just yet, so we'll let you know as soon as we do. So on that note, I'll ask Madeline just to present the report.
Thank you. So this is just a very short report to formally ask the board to agree to an additional representative to the board from the GP Alliance, Berkshire West GP Alliance, beg your pardon, and that representative is Dr. Sharma, because under the Health and Social Care 2012 Act, the board is responsible for agreeing any additional membership outside its core membership as set out in the legislation, and the additional recommendation is just to ask that council notes the necessary change to the constitution that would be caused. Thank you.
Okay, can I have your approval? Lovely, great. Okay, that's all approved. Welcome, Amit, formally to the board.
Thanks, Chair. Can I just add one thing? Not to expand it much, of course, but just to say that we will be having sort of some elections as well later this year, just around GP representation, because we have a cycle, a 3-year sort of cycle. So we will be having some elections, and as part of that, we will be having sort of Wokingham Health and Wellbeing Board meeting attendance. So just to ensure you're aware that will be happening in sort of April, May time. So it may still be me, hopefully there will be me, but it could be another colleague, depending on the outcome of that, just so that you're aware of that process.
Okay, we had a slight issue with sound quality in here, but I think you were saying you may be replaced by somebody else later in the year. Is that right?
Possibly, there'll be an election, and elections are always unpredictable, so we'll see what happens. But yeah, I think we'll have a member on here, and yeah, maybe somebody else.
Okay, Stephen.
I just wanted to say that we also have elections, so who knows what will happen. But I'm sure that we'll be very, very pleased to see whoever comes representing your body, and it's great to see you here. So thank you.
Okay, so that one's approved, and we will move now and ask Ben to present the ICB briefing, which you quite bravely put on paper a few days before, so let's hope it's still current.
Thank you very much. Yes, it's a rapidly changing sort of role at the moment in the ICB. The work is largely focused on progressing the organisational changes around the development of the new Thames Valley Integrated Care Board. I think I mentioned in previous updates that we've created a joint committee between the Bob and the Frimley boards to progress that work. That's continuing to meet regularly. I also updated last time that we produced the joint commissioning intentions for Thames Valley as well as a initial sort of setting out of the strategic direction and the priorities with particular focus on that shift towards prevention, the development of neighbourhood health, as we've heard about already this evening, and sort of several other areas of sort of priority, really, thinking about sort of based on the population health data, so cardiovascular disease prevention is another example. We've also, and this has just been referred to by Andy in the statement from RBFT, as part of that process, created an innovation fund, which is a way of basically encouraging and enabling providers to bid for funding to progress the areas of work that particularly align with that 10-year plan and all those objectives and the intentions. And it's a way of sort of encouraging innovation and allowing things to sort of progress in that way. So they're the sort of main areas. It's already been mentioned as well about the winter. So the other big area of focus, of course, is business as usual and making sure that we're continuing to deliver good care as a system for residents through the winter. Despite having an early surge in respiratory illness that did get us a little bit worried about a month or so ago, actually the performance has been very good. And in fact, I think I'm right in saying we were the highest performing in the southeast region for the emergency department wait times. So that was good to see. And then we've already mentioned again the industrial action, which I was going to highlight, which the trusts have managed very effectively, and I think we've managed to deliver 95% of usual elective activity despite that challenge as well. So they were the main highlights, but obviously happy to take any questions.
Thank you, Ben. Do we have any questions or comments for Ben? Alice, would you like to come in there?
Hi, Ben. Hi, everyone. Ben, it's about the innovation funds kind of thing. The time scale for putting the application in was quite challenging, and I'm keen to find out who made that decision to do that, to put in to give such a short time scale, because it didn't give us much time over Christmas and things like that. It's just, I think it's quite what's the word, turmoil. It was quite causing a lot of people a lot of distress.
Come back on that. Yes, I agree that the timeline was quite challenging. It basically reflected, when we found out about the allocation, how much money does the ICB receive, was quite recent that we found out that information, and then so it all had to be done quite rapidly, unfortunately, to fit with the planning timelines that were set for the ICB. So it was the ICB executive, the Thames Valley transition executive, that had to make that decision, but it was still felt that was a better way to do it and to involve the wider system and give people that opportunity to bid, albeit it was quite a compressed timeline. It's not the end of the process, it's just the sort of starting point, really. But yeah, unfortunately, we don't always have control over the timelines that we have to work to.
Thanks, Ben. Alice, did you want to come back on that, or you?
I mean, I would quite like to understand what you mean by the not the end, because are you saying that there is another tranche of money coming, or is this the only phase of money?
So the process is just to put in expressions of interest to start with, which don't have to be particularly detailed in that respect. It's not like full business cases of things, so they can be done relatively rapidly, and then there'll be a process of working those up through sort of panel to look at how because we're anticipating that there will be more people applying than we will probably have the funds for, so that there's a process to go through. So it's the expressions of interest bit that you're referring to with the deadline as the start of the process, just to put in the expression of interest.
Thank you.
Yeah, thanks, Ben. I would say from a partner perspective as well, it wasn't conducive towards building effective partnerships, nor necessarily innovation. And with the word innovation in there, are the expressions of interest going to be particularly judged on being innovative as opposed to another source of funding for business as usual?
Yeah, I think that will be one of the criteria. I'll feed that sort of feedback on the process to the commissioning team. But yeah, as I understand it, there will be criteria sets, and a panel will look at those and judge them sort of objectively and fairly based on that. But yeah, the aim is to encourage innovation, and to particularly things that align strongly with the the three shifts, really, that we talked about with prevention and and move to community, those sort of things that are set out in the 10-year plan. Yeah.
Okay, thanks very much. Susan, would you like to come in there?
Thank you. And I agree with the points about the timeline, so I won't repeat those. I just wondered, for the benefit of the board, Ben, could you say something about how the evaluation will happen, as in what the thinking is about who will actually do the evaluation?
I'm probably going to have to take that one away to get back to you. Maybe best if I speak to the team and then we can share, because I think this is probably something that I need to sort of just check with them in terms of the detail of that, and then maybe provide you a written answer, if that would be all right.
Thank you.
Okay, thanks, Ben. Thanks very much for that. We'll move on to the final item on the agenda, which is the forward programme. So we have some items, I think, already set out for the forward programme. Does anybody have anything to add to those? We've got the update from the early part of the meeting that's noted in a year's time. That's quite a long way ahead. Anything else to add or to note? Specifically, no. Okay, we'll take it as it is. And I will then just like to thank you all for your attendance and contributions. And we close the meeting. Thank you very much.